your flow increase after 2 days, you have to confirm it. That also we have to read from the Mathematica only. Then ovarian cyst, yes, mentioned by some medicines are covering which are having cystic pathology. Then we have to read from the ovaries part also, which are medicine covering from the cyst. How a cyst are. It is having the mass cyst or only fluid cyst is there. We have to confirm it from reading part. So the medicine which I gave now, it was MACCAP. MACCAP 0.1 potency. The dose was 10 strokes, 40 drops in 100 ml water and 2 teaspoons BD. I gave the medicine for her state to regularize the menstrual timing. The timing was deranged. It was becoming late and late. For derangement, I gave the Medica from 0.1 to 0.3. For proper 3 months I gave. After 3 months, her menstruation came properly in time. Accurate 28 days to 30 days it was cycle was there, but not late than 3 or 4 days. But timing was there. Then from that, MACCAP also the scantiness and the flow, the dark color of menses also got changed. See what were the hormone change was there in the her part. That medicine also changed by MACCAP properly, and whole the pattern got changed. Yeah. Then after that symptom, her old symptom started. After giving the MACCAP, has the reverse order start na, in that manner.
Sir,
After
what is the second sentence, sir? Which words we use for search for arriving to make
menses delayed. See in MACCAP, it is mentioned menses delayed by 4, 5, 6 days. From duration I search MACCAP. In delayed you will get many medicines, but from how much delayed it is, that we have to confirm the medicines. CP is also there, other medicines are also there, but how much delayed, how much early in Kali carb or any other carb medicines, there are early, 5 days early, 8 days early, 10 days early, 20 days cycle, 15 days cycle, how much early it is, we have to read from the Mathematica. In MACCAP, those symptoms were there, 3 or 4 days she was letting late menses, or 15 days late the menses should come. Those patterns are available in MACCAP. Huh? Only that. Okay. In after 3 months now, again she had the skin eruptions on skin and toes, which was suppressed in the childhood when she was a student life. They have given the graphite ointments, when she was in puberty time, and those eruptions vanishes suddenly. She was suffering with perspirations on hands and perspirations on toes since childhood. Hashimoto thyroiditis. These are symptoms of Hashimoto thyroiditis. Remember, and weight gain. Weight gain was there after pregnancy, after marriage. Itching on the skin and sole, which was exfoliating. Only on the toes were there, and sole region was there, and the skin was exfoliating. पूरा skin निकल जाता था, peel off पूरा हो जाता था. On that, itching was there. Moist itching was there. Very moist, very we see sticky discharge was there, and day and night aggravation, and eruption was thick and coming back. Then we consider the graphite medicine. For a graphite, his whole state again. Graphite medicine work on menstrual pattern also, which are the menstrual. How we confirm the menses also of the patient. Then again for we, after not giving the single medicine for 0.1 potency, we see how the skin eruption is going. Till 0.3, in next 3 months all eruption vanish properly, and whole skin of the hands and perspiration of hands and palms reduce completely by graphite medicines. And again the menstrual quality was also improved before than that, which was a little better than MACCAP also. So we gave him MACCAP graphite 0.1 to 0.3 potency. At least 3 months we tried it. Whole symptom whichever is there, it vanishes after. Then after 3 months, again she told us that the eruption was completely reduced. No skin, the skin quality of the whole body, because of the allopathic injectables and hormonal medicines for there, that also had completely reduced. She was have tan and discoloration was happening in the body. Whole skin, hairs and already recovered by after giving the graphite medicines. And very dark she was seeing. She reduced 6 kg weight in last 6 months after treatment. So now she gave me the symptom. The pain was there before in Mame 10 days before menses. This time she started the pain, and this is all the signs of Hashimoto thyroiditis. Any complaint before menses, are related to thyroid complaint only. You should confirm thyroid reports. Any complaint coming before the menses, they are all related to thyroid disorders. So we have to confirm the medicines, which are the medicine coming for that, and we should do the report regarding those pathologies. Then we searched the medicine as we were frightening. We was in early phase that was not practicing full-fledged LM potency, but we read the Conam. Conam is a medicine for cancer. It created cancer in the body. So it can prove also anyone. So already case was very difficult and tough, and how can we try? So we tried very low dose, become low dose. We tried 1 teaspoon or only take once a day. We tried, let's see what happens. But I need very low dose. I was not experienced in that time properly. So 3-4 medicines came at time. Asteria Zuben was there. Conaim medicine was coming. These two medicines were available. But Asteria Zuben was not available in LM potency. So I gave him Conaim. Conaim. It was not available with us LM potency. So in Conaim, I was having Conaim LM01. So I started by fearful way. Let's see what happens. Huh? Then I gave the dose 10 strokes, 30 drops in 100 ml water, 2 teaspoon BD. Okay? Huh? 10 days before. 10 days before. Huh? No, they have no mention. This is a complaint. She started before menses, the pain was started. No, days. In menses, they have mentioned how many days late menses are there before menses are there. Huh? Huh? It will work also. Those symptoms were making very well in those. But I was not having 30 potency, 200 potency, and even LM also. And I am practicing very far away. The medicine come after 10 days when we order. So I think we cannot get a medicine. When we go to the Mumbai or any, then only we can get by hand. Otherwise, in the LM potency it is very rare that time. Now many we can get it easily. But we also that time. No, in LM also and 30 potency. I never use active Zuben. Active Zuben.
Search was menses before marriage.
Okay. After that, the pain in the mammy got reduced. After one bottles of 100 ml water, then again this symptom was there, old suppressed symptom, which was suppressed initially. Skin of the palms and sole warm, sweating profusely, which was suppressed by old symptom. When she was taking the homeopathy treatment in Mumbai, night time suddenly the suppression was there. By taking homeopathy medicine, all suddenly on 1 month the suppression happens. Means suddenly the perspiration vanishes totally. And after that the menses again got delayed. So these symptoms and eruption on toes and sole. Again it was healed also. Overall skin was proper healthy. Okay, and menses were even regular, red, 4-5 days proper, painless, no mammy pain and before menses. Means whatever the criteria she was fitting, late menses, character of menses, the pain before menses, all the criteria was solved out. So I need to give sulfur this time. All the fulfillment. I have to handle with now the king of the antiseptic medicine. I started sulfur 0.1 potency, 10 strokes, 40 drops and 100 and 2 teaspoon. Why I gave? Every other symptoms were not present now. So I started, I should give sulfur. If smaller the other symptoms will be unnoticed by me, it will cover by sulfur. So I started sulfur. After sulfur, she gave, we gave the medicine, but she, after giving the sulfur, again menses came late. Menses was not happen. So I thought I may be wrong. After giving sulfur, the menses again did not appear in time. I thought I may have missed anything, something else. The 7-8 happens, though nothing was happened. Nothing happened. So I told her, let checks urine pregnancy test, see what happens. Then she in the early morning, she did a test which came light positive. Light positive means when we drop the urine drops on the sample, test tube card sample, immediately the contourity line should be seen. But in this case, it came very slowly. Within the 2 minutes, we have to read the sample, but it came very slowly. It was very light, not perceptibly seen also. So we decided to do UAG weight confirm what is the situation inside. As his history, he was having history of ectopic pregnancy. I was fearful also. Nothing should be happened this time. We will try it. Okay. In 21 next day, we found that in UEG the intrauterine pregnancy was there. It was better. Pregnancy is intrauterine. G sac is present. 5-week pregnancy with yolk sac seen. But the sonologist, what he told, there was no development of fetal pole and fetal pole. The fetal pole which is necessary for the sac and development of the baby inside, fetus inside. There was no only G sac were there, but no fetal pole was there, development seen. And he told only mild activity we can read on the sonography machine, but no suggestion. But he told, I have seen many cases, you go to the gynecologist and about the case. You go in the evening or you go now about the case, there is no necessary. Even if you will come after 10 days or 15 days, the fetus will not grow, and same process you have to do again and again. So you drop now only, otherwise you will be in complications. So he suggested suggestion to the patients, it will not develop and no survival, no growth happen. If happen, then also the baby will be congenital anomaly. So anything can happen in the baby. As it is a genetic problem, they told. Some problems because of your age, pregnancy, that my problem may come. So he told everything to her. She started crying in the pregnancy hall only, sonography hall. So she came back to us. This was a sonography report, May 2017. Okay. No obvious fetal pole seen, cardiac activity visual. Yolk sac is seen, intrauterine pregnancy 5 weeks. Dead. Okay. This is the magic of the homeopathic medicines. Again, I started with sulfur. You continue with the sulfur. Sulfur, I gave him more dose, 10 strokes, 40 drops, 100 ml water, 2 teaspoons, 3 hourly. And we review after 3 days. What is the results? Repetition, I increase the repetition and increase the dose also. After repetition, see what magic happens. The magic of antiseptic medicines. After 18 days, we repeated sonography and we gave a proper diet. In that time, was a nutrition maybe hamper or anything can happen. We gave the right from the natural food only, not external tablets we gave. Then after 18 days, the positive changes came in the report. G-sac developed properly. Embryonic pole was seen with a growth of 8 weeks and cardiac activity of 142 beats per minute. Okay. This is the report. 7/6/2019. Cardiac activity seen. G-sac already whole the fetus has been ready for development. See the power of antiseptic medicines, the magic of antiseptic medicines. Okay. Then we continue sulfur 0.1 potency for a whole 1 trimester. For second trimester 0.2 potency and for third trimester 0.3 potency. As Hahnemann sir has mentioned, if you want to avoid the SORA from the childhood or from generation, then you have to give the sulfur in pregnancy time only, or whichever the antiseptic medicine comes